Demonstrators are on the way to 10 Downing Street. The demonstration has paused the system, and a spokesperson, Kerry Waters, joins me now. What is it how many people are coming, and what is it you hope to achieve today? Good morning.
Good morning, Nick. At the moment, there's about 15 of us. The reason why we're here is precisely because of what the junior doctor has just said. The government are putting a burden on the NHS by not pausing the system, by not listening to the World Health Organization and their recommendations to go into lockdown. The herd immunity idea is just an idea. It's not backed by scientists. We don't know if we can get immunity. Why should the UK be a guinea pig for the rest of the world?
So what do you think should be done?
Well, we think that the government should put everyone in lockdown, which means we should follow the example of Ireland, of Italy, by closing schools, non-essential business, practicing social distancing, wearing masks, encouraging people not to go to work, but also providing the means so they don't have to, like statutory sick pay.
When do you open the schools?
Well, that's the decision for the scientists, but the thing is the government...
The scientists are the ones who say we don't need to close them. So you've now overruled them by closing them. So my question is to you, when do you open them?
Well, the question is, which science is the government listening to? A letter from hundreds of scientists has been written to the government to demand where they're getting their sources from. We don't know why we're not following the example of everyone else and listening to the World Health Organization.
None of those were virologists, of course. None of those were experts in this field.
Well, the experts in the field...
It's a fact.
Well, the experts in the field, including the medical field, including the World Health Organization, are saying that we really need to follow everyone else.
When has the World Health Organization said the United Kingdom needs to follow everyone else?
They've come out, they've criticised, the head of the World Health Organisation have criticised us.
No, they haven't. They've said it must fall to each separate country must make its own decisions based on the data.
They have, but they are seriously concerned about the policy that the government... They're seriously concerned about the policy our government's...
We close all the schools. Who's going to look after the children?
Well, that's why we need the government to enable people to work at home. And people that obviously they can't work from home, they're going to have some sort of provision. So what we need the government to do is to be providing the financial means for people to do this.
Well, I don't understand what you mean. Hang on. You've got a group of children, right, and their parents are doctors or nurses or whatever, and their grandparents sadly are no longer with us. Well, who's going to look after those children? Or are you going to take doctors and nurses off the front line?
Of course not.
So where do they go? What happens to those children?
Well, doctors and nurses are one thing, but what we do need the government to do is to be able to provide childcare, for example, to help people. There's a lot more we could be doing, and I think that's the point. Well, not technically centres, but we already have people who are trained in it, but that's not the point. The point is the government is not doing enough.
Where do the children go?
Well, these are limited cases, and of course we will have people who are childcare providers who are trained in this.
So you just put them in a different centre with a different name.
But that would be 10 times better than having that many children in one school if we were to just take out the children that were able to be looked after their parents. We need to follow what other countries are doing. We can't just leave this country as a running test of whether herd immunity works.
How on earth do you think a country can self-isolate? Seriously?
Well, countries are self-isolating.
Well, not with
France,
any great
for
success,
example.
are they? They're not. What are you talking? The planes are still flying out of France and the boats are still going into France. They've not self-isolated at all. They're closing shops. All apart from food and pharmacies and takeaway restaurants. But no country can self-isolate.
But that's what we're proposing.
Naive. This is beyond naive.
Well, it's not really beyond naive, because what we're proposing is exactly what those countries are doing right now. We are doing so little compared to those countries. We've seen and we've heard from what the NHS staff are saying, and we should really be listening to them and taking this seriously.
Right. Lastly, they are part of the emergency services, as are the police. You and your colleagues will tie up a number of police officers to keep you protected and others protected. How wise is that?
Not at all. We are not here to get arrested. The only police are here are the police that are already stationed. When they have asked us to move, we have moved. We have let in vehicles. We are not here to cause any disturbance or to break the law.